So this is a good place for us to turn into how we disrupt whiteness. Here you see James Baldwin, queer Black man, amazing writer, one of my favorites. James Baldwin says, how do we disrupt? Not everything that is faced can be changed, but nothing can be changed until it is faced. I want to circle back to some of what Nancy was saying about reconciliation without truth telling. I think as we try and as we think about disrupting whiteness, and I'm seeing this show up in the chat box, we need to fully understand what it is and how it manifests. And in our work, really pinpoint, okay, in this particular situation, what is happening? So a lot of times we're looking at people and we're not looking at processes, we're not looking at policies, we're not looking at practices. And we really need to be paying more attention to that. So we have a question for you, which is a version of the earlier question, but now we're going to organizations. How can an organizational commitment to health equity be better positioned to disrupt systems of whiteness? I think we heard some great examples from Nancy and Alycia about how even with commitments to health equity, we can still do work which doesn't fully name whiteness, disrupt whiteness. I'm always amazed, and this probably shows up in some of my own work, of how often we talk about racism, but we don't talk about white people. We talk about racism, but we never talk about whiteness. And when you do say, whoa, we just went there. And so yes, today we are going there because that really is the problem. I think Let's Talk Racism, one of our publications, there's a quote in there which says, if racism is the disease and racism is the symptom and white supremacy is the disease, which means that is really where we need to be shifting our gaze and dismantling. I think as we do this, we recognize that this is a long-term process and that we need to make space for this kind of work within our organizations. One thing is really making whiteness visible and moving beyond the kind of denial, Alycia was speaking to. And as we do so, we need to view settler colonialism as central to the conversation, and so that we're not proposing individual solutions to systemic problems. So a great example: how often in the news do we hear about XYZ said something? Oh my God, it was so racist. That is important, particularly if they're a decision maker. But even more important is saying what levers do they have within their toolbox, which they're using in ways which are harmful. Because again, I find the way in which we individualize social problems, I think it's a really big distraction, and it does something very powerful. It's a very powerful way to keep systems unexamined and intact. So I think we should be very wary of those kinds of conversations. Also, we need to recognize that whiteness itself is a driver of inequities. And as organizations start to invest in doing more and more of this work, it is hard work, it is emotional work. So we need to make space for that within our institutions. It will lead to conflict. I can guarantee that for any of us who have been in those conversations, you know that. You talk about racism, you open up that space, right? And so we need to make sure that we have the resources to support staff in this work. And I would say particularly Black, Indigenous, and racialized staff, because I think as organizations seek to decolonize, right? Well, some of what Nancy was saying, and become more anti-racist, the burden often falls back on the shoulders of those who experience it most. Also need to really explore our own racial identities. I think particularly for white folks, and some of what Alycia was talking about is supremely important. I am going to pass it on to Nancy, and we're now going to start talking about some specific things which we can start to think about in the public health context in terms of how we disrupt whiteness in practice.
Thank you, Sume. For those of you who have had an opportunity to look at the Let's Talk Whiteness and Health Equity paper, you'll recognize this diagram. This is kind of how we conceptualize moving forward. Public health must take on critical roles grounded in unlearning whiteness to disrupt whiteness in policies, programs, practices, and processes. Transformational unlearning, the practice of challenging assumptions and conventional wisdom to adapt, is an essential foundation for disrupting whiteness. We have to continuously unlearn racist attitudes and practices at an individual level to reveal and address racial inequities at a systemic level through mutually reinforcing institutional change, community-driven action, and public policy. And I'll turn it over to Alycia.
Okay, thanks, Nancy. There's such great comments that are coming in. I just wanted to just, you know, as Nancy said, like this, you know, when we're talking about disrupting racism and just commenting on Sume's comment about conflict. And yes, you know, it's my experience as well. There's always going to be conflict when we talk about whiteness, anytime we talk about race or racism. And I always think, you know, when I'm talking to people about addressing racism, you know, in an organization or anywhere, that if there's conflict, if it's uncomfortable, if it's emotional, you know, you're on the right track. If it's not any of those things, then you're not doing the disrupting, because that's what disrupting is. It's shaking the ground that you're standing on. So when we're disrupting whiteness at the individual level, this requires a certain amount of unlearning and unsettling at that individual level. And when I think back about my own unlearning journey, I can think about some pivotal moments, and they began with paying attention to race. So for example, I remember working in an inner city health center, and this was in Toronto, that served many Indigenous clients. And I remember noticing how many Indigenous people came through the front doors as patients and as service recipients. But not one Indigenous person worked on staff or as a clinician. And I also noticed that there was little to no representation of Indigenous peoples anywhere in the facility. It was like a total mismatch, especially on Indigenous territory. And I became curious about it. Paying attention to race is like the opposite of color blindness. It's where we attune ourselves to race and racial inequities, and we can start to see whiteness. When we start to pay attention to race and whiteness, then we can start to insert ourselves into the race conversation. And this means exploring our own racial identity. So I shared a little bit earlier about my journey on coming to terms with my own whiteness. But what I didn't mention, and what Sume alluded to with emotion, was how emotional this journey was for me, especially at the beginning and at the earlier stages. And, you know, sure, I can get up here now and I can talk about being white after years of work and practice, but I had many feelings along the way. And it has been so essential, life-changing, and rewarding to have these conversations and to work on my own racial identity development. But it wasn't easy. And as a white person doing research in Indigenous health, I can recall several times being called out on my white privilege during conference presentations, for example. One time, a classmate of mine and a woman of color whom I respect stood up at the end of my presentation, and she pointed out how it was white researchers like myself who are most privileged in the university, who get all the big grants and status off of the backs of Indigenous peoples, while Indigenous, Black, and racialized students face so many barriers. And this was painful to hear because she was right. And in my growing awareness of whiteness, I became even more deeply unsettled. Unsettling whiteness is emotional work. And I just want to say that this is a totally normal and natural part of unlearning. And it's important to allow us space to face our emotions and to sit with them. We got to feel the feelings. And it's important that as white people, we do this in a way that's not at the expense of racialized people. So I've seen many examples of white people who will express grief or anger when confronted with issues of race or racism or whiteness. And this can be harmful or even violent for racialized people to witness and to experience. And this is why we often talk about racial caucusing, or basically we just mean racially segregated discussion groups to talk about these issues. This is why they're so important in this context, because it allows white people to process with other white people and work through our emotional fragility, our white fragility, without subjecting people of color to our ignorance or our violence, even when we don't intend it, but we do. And having BIPOC only spaces are so important to create a sense of safety for BIPOC people also working through these issues. And it's also very common for white people to lean on racialized people to be educated on issues of racism, or even sometimes for comfort to say, you know, am I on the right track? So doing our own learning, and that includes reading and listening to BIPOC perspectives, BIPOC authors, BIPOC filmmakers. This is a key part of disrupting our own whiteness. So once we've learned to notice whiteness within ourselves and in our organizations, then the next step is to start talking about it and pointing out examples of whiteness when we see it. So it can be really helpful. And I just say, Sume had a great example of that sense of urgency, right? You know, when that comes up and be like, oh, you know, here we are like working under these, you know, colonial norms. So it can be really helpful to find others to talk to about whiteness and to help find your voice in anti-racism. Find your anti-racist friends, find your anti-racist role models. And for white people, this means finding other white people to learn and grow with. And here's a tip for you that I've learned from my experience. By identifying your race and ancestry in conversations, or when you're introducing yourself to a group, or even just by talking about racism and whiteness, just having those words come out of your mouth, you can often find your friends really fast. And I know for myself, as soon as I hear someone say racism or white supremacy in any conversation, my ears perk up and I know I've got a potential new friend in front of me. And I know the same thing happens the other way. As soon as I say white supremacy, you know, I can find see who my friends are. And lastly, don't be afraid to take leadership on addressing whiteness. And this especially goes for white people. And as I mentioned earlier, whiteness is a white people problem, and we can't leave it for people of color to address alone. And in my experience, it's actually rare for white people to be willing to lead anti-racism work and to step up in that way. And it's especially rare for white men, but it's so needed. It's so important considering how much privilege and power white people have in our society and in our institutions. So that's it from me. And I'm going to turn it back over to you, Nancy.
Thank you, Alycia. It is important that first we focus on understanding and addressing the power of whiteness in our own disciplines and institutions. We must influence institutional processes and practices in all parts of our organizations to foster health equity through the disruption of whiteness. For example, hiring, funding, program development, leadership and governance, policy, partnerships, research, and knowledge production and translation. Leaders in positions of power and privilege need to engage in action and provide resources to facilitate change. Interventions need to be focused on systems of whiteness rather than BIPOC. Educational interventions are a good start and could focus on things like meritocracy, equal opportunity, individualism, objectivity, and the belief that good intentions are more important than the impact of our actions. Me and White Supremacy by Layla Said is a good workbook that can be done individually or in a group. And the Dismantling Racism website also has some really good resources. Next slide, please. Okay, community-driven action. The first key piece is that we need to move beyond consultation and advice and advisory committees, but actually have to take direction from, be accountable to, and work in partnership with BIPOC communities to dismantle whiteness and what is considered normal in their institutions. As mentioned earlier, BIPOC communities and organizations must be invited into the process without the expectation of assimilation into a culture of whiteness. In terms of Indigenous people, you probably have noticed in the last 500 years that we're not that into that. BIPOC should not experience any negative repercussions when we challenge the status quo, which I think you probably, any racialized person on this call has had that experience. We need to move beyond the creation of advisories in terms of Indigenous peoples to move to governance and governance councils to enact UNDRIP and self-determination of Indigenous peoples. Thank you.
Thanks, Nancy and Alycia. So we'd like to wrap up our presentation by talking about the last role, which is public policy. And here really, I want to say that right now, as has been the case for a very long time, there are lots of Black, Indigenous, and racialized folks who have very specific policy demands, very specific calls to action. I think one way in which organizations can start to think about public policy and what it means in terms of disrupting whiteness is looking at those calls and paying attention to them and supporting them. But supporting them in ways which not dilute or co-opt them, right? So I think one great example is around calls to defund the police and really calls to disrupt the kinds of harms which happen in the criminal justice and police systems. Calls to defund the police and to demilitarize the police have quickly been taken up into organizations as, I've heard things like, oh, let's partner with the police. That's not what communities ask for. They didn't ask for better partnerships with police, right? So I think sometimes when, as institutions, we want to partner, we want to take up this language and do work, we can sometimes actually undermine the work communities are trying to do. So as we think about public policy, it's important to really pay attention to both the substance and the real demands of communities, support that without diluting or co-opting them. And public health has supported social movements in the past. Great examples around tobacco control, right? Like public health has actually been funded to do active advocacy and policy development work. Why can't we do the same for around work to dismantle whiteness, right? So I think we could be thinking really creatively about that. There's really need to invest in systems of care, and even those systems of care themselves have to be sort of disentangled from whiteness. I noticed in the comments, there was a comment about not really thinking about this idea of rush as a manifestation of whiteness, but just healthcare. I think that's a really good example of the fact that these ways of working have seeped into all of our systems. So a lot of the times, unless you're paying attention to what we've been saying, it's easy to say this is just the way things work, especially if it doesn't really harm you in a deep way. I think as we do so, we need a blend of really universal approaches as well as some very distinct approaches. British Columbia in 2019 passed its Declaration on the Rights of Indigenous Peoples, which is really bringing UNDRIP into BC law, and this current work at the federal level to bring UNDRIP into federal law. I think it's worth remembering that when the UN Declaration passed, there were 4 countries who opposed it. What do those 4 countries have in common? They were the settler colonial states, right? Canada, United States, New Zealand. So most of the times our governments will not embrace this, and so they need that active pressure and advocacy to keep these issues on the agenda. Nancy shared this with me recently, which I think is another great example of how policies can be used to enhance gender equity and reduce the harms in some of those systems. This is the change to the Divorce Act, to really put in family violence into that act. This was already on the way in BC, and it's new in federal law. And I think we all know that Black, Indigenous, and racialized women are more likely to experience all various forms of violence. So by having that kind of protection in the law, it protects everybody, and it offers some really specific protection to racialized folks. Some other examples like those like that exist. There's one great resource that I came across recently, which I wish we had in the Canadian context, but I haven't found yet. It is a database of state-level policies in the US which contribute to structural racism. And this was work done by legal scholars as well as health equity folks, so some legal folks, some public health folks, really saying in this states, here are the kinds of laws which are creating harm. And I think this is important for many reasons. One is there's this big conversation now on data, where we don't have race-based data, which I believe is a limitation in our public health system. We need good data. But what does our data do? A lot of the information we collect is really around surveying and monitoring communities. It's saying there's a problem, which communities, by the way, already know, right? So we can use this data in good ways. Are we investing in turning our gaze on the system? Nancy and some other folks are working on a piece which they called Surveying the Settler State, which I love, and it needs to be published very soon. And in that, they're really making the argument that instead of us continuing to count death and suffering within communities, we need to say what within the systems are creating harm. And this example of this database of policies which contribute to structural racism is a great example of how we can start to look at what is happening within the systems and start to counter a lot of the damage-centered research which currently exists. I think obviously investing in a whole slew of determinants of health, so things around early life and education. We know that for education is a site where a lot of folks are harmed. So really paying attention to that. We can think, I know someone in the chat box mentioned that they are interested in environmental racism. There's some really great work happening around resistance to environmental racism in different parts of the country. But I'll mention work happening with Dr. Ingrid Waldron, who is in Halifax, and she's been doing work with Mi'kmaq and African Nova Scotian communities trying to address environmental racism in Mi'kmaq. Other examples like that exist. The one which we mentioned in Let's Talk, which I think is really important, in addition to talking about police violence, is around the child welfare system. The child welfare system continues to be a profound source of harm, particularly for Black and Indigenous children. And when we go back to history, we talk about the 60s scoop for Indigenous peoples. Right now in the child welfare system, you have more kids who have been removed from their families than happened in the 60s scoop. So I think, again, Nancy was talking about asterisks, right? So we remember these are not historical things, but systems continue to reproduce those harms. So child welfare is another great place for intervention. I'm not sure if there's anyone from Winnipeg Regional Health Authority. I know you, if you are, I know you all did some analysis looking at some of those pieces from a public health lens. So there are tons of examples, and I think what I'm going to leave this piece with the public policy piece is that as we think about whatever work we're doing, there's an opportunity for us to stop and pause and say, in what ways am I acting which can continue to reproduce harm? And oftentimes, if we're not asking ourselves that question, all we do is just continue to play the same old story and the same old script. On that note, I'd like to thank you all so much. I know there are tons of questions in Slido, which we will go to in a second. But as we pull that forward, Nancy, Alycia, some wrap-up words before we go into our questions.
Sure. I was on a webinar on Tuesday night with some elders from Ontario here, and there was this one elder, Mary Deliri, and I'm paraphrasing here, but she had this great piece where she said, "Many people are responsible for systems change. This starts with a true relationship of caring for each other and respect." And in my mind, I just thought, well, we should present this. I mean, it's kind of like a foundational radical idea that it first starts with us caring for each other as people and the world. So I just want to kind of throw that out there as a different way of thinking. Thank you. Alycia?
Thank you, Nancy. Thank you, Sume, and thanks everyone for all of your comments. And I noticed, and I know we're going to get into discussion soon, and I saw, there were some, a few about comments around how we do this work, and, and where do we start? And, it is difficult work, it is challenging work, it's emotional work, and it's just important that we start somewhere. And I think, one of the other manifestations of colonialism is also this, this perfectionism idea, and this idea that we just have to talk about our successes and we can't talk about what we did wrong and we can't talk about our mistakes. And, when we're going about this work, when we're disrupting whiteness, that's so important to do. I think as much as we can recognize that idea, to always, to get that A and to do things perfectly and to do things in the right way. And, if I talk about what we did wrong, it's a sign of failure. That is all a manifestation of whiteness. And so by allowing ourselves to honor and to take pride in our ability to reflect back on what we learned, I know when I see other people standing up there in my life, when I see how they've really talked about, things that they've done that were inequitable and wrong and racist, and they're reflecting on it in front of other people for the purpose of learning, because they care about the issue so much. It's more important for them to help others learn and foster other people on their learning journey than it is for their own image or their own ego. And I admire people so much in that way, and I strive to be like that. I hope to be more like that. It is hard, but I guess that would be my last word that I say. As we go into this conversation, let's allow ourselves to own and be honest and to honor our mistakes and to let go of that perfection. It's not about perfection. It's about, you know, taking one little step forward and making things a little bit more safer and more equitable than they were before.
Thank you, Nancy. Thank you, Alycia.